actually going to get a certificate for participating in HIPAA, so feel free to participate so I can, it's more fun if we have interactions. So this is an LPN to RN program. So one of the things I was trying to figure out is, what does that mean? I think that's something you're also trying to figure out. How is this going to be different from an LPN to an RN? And I think one of the ways is that as I went up through my courses, you get a higher and higher view of what's going on with nursing and with the healthcare industry. And, it's kind of that 10,000-foot view. So when you're in an LPN role, you're focusing on the patient, the medications, the care, the skills, all of those things. When you go to the RN role, it's a broader view. You're now looking at, of course, the patient, saying everything you did before, but what's going on in your unit, what's going on in the hospital, how is this all connected? How does this fit with organizations? Because hospitals are now part of bigger organizations. And then the whole thing with Obamacare. This is going to be a huge change for nursing. So how are we going to fit in? Because one of the things with Obamacare is prevention. We've all heard about that. So, and it's also going to be related to prevention and patient satisfaction. And that's how you're going to get paid. So we're looking at how nurses, what is our role in preventing things, and also in patient satisfaction. So I was thinking, all right, so how is all of this things, medication errors and HIPAA, going to fit together? And at first I thought, I don't really see a connection between HIPAA and medication on the smaller scale. But if you pull back and you look at it on a larger scale, there is a connection between them. When it comes to patients, taking care of patients and medication errors, we have like the whole system you're going through. So I call this the chain of potential medication errors. I made up that term 2 days ago. All right, and the reason I wanted to talk about this is with medication errors, I'm always thinking about the medication error is just about the nurse at the bedside who gave the patient the wrong medication. Okay? That's what I always think, because that's our worst fear. And then when you're that nurse, and one day you will be, you think, I am an idiot, I should not be a nurse, and you just really beat yourself up about it. But what I want to look at today is the 10,000-foot view. You're going to think about as an RN. Is it just that nurse? Was that just the mistake of one person? Or was it a bigger issue? Okay, was it a systems issue? What happened to create that error? Like the little mistakes that led to something bigger. And there's actually something called root cause analysis. Does anyone know what that is? Have you heard of root cause analysis? Okay, so if you've ever been involved in a situation where there's a mistake and harm came to the patient, what they'll do is look for all of the blood, all of the people that were involved in the mistake, and set them down, and take a look at everybody's role and what went right and what went wrong, and how do we get to this. So that's kind of what hospitals are doing now, and it's all part of this whole big umbrella of Obamacare. How do we take care of the patient all the way through the system? So my made-up term, chain of potential errors, I thought this is not just about that nurse at the bedside. That's not fair for us. Medication errors happen all along the way. So we have the patient at home. Okay? What's going on with that patient at home that are taking their medications? All right? So when you think about in your home, either with yourself or your children or parents or grandparents, are they taking their medications the way they're supposed to? All right. Then how about this is my chain link. At the doctor's office, what happens when that patient comes to the doctor's office? What are the potential errors, medication errors, or omissions that happen? And don't forget, there's a lot of people at the doctor's office too, right? It's not just the patient and the doctor. it's the staff, right? It's the nurse, it's the receptionist, it's the person entering things into the computer system. So what mistakes happen there? And then, then the whole relationship with the pharmacy and getting your medication. What happens between the doctor and the pharmacist? How does that get communicated? Is it done electronically? Is it a script? See any issues with reading physicians' handwritings? Right? Right? So those are the things we're going to think about. And then at the pharmacy, you know, you go into a pharmacy, I don't know, like Walmart or something, you know, it's crazy what's going on in the pharmacy, how busy they are. You think they're 100% accurate? Okay, so this is my version of outpatient. All right, and then we're going to talk about what happens inpatient. So what happens when that patient comes to the emergency department? Let's say they're a snowbird or come from Canada. Something is happening, broken arm, broken leg, stroke, heart attack, anything. How does this impact with their communication? When we say to them, what's going on with you? What are your meds? What are your history? All of that. And then the nurse was taking that information. What is the potential errors that nurse is making? Not only with the first meeting the patient, but while they're taking care. And then, of course, the nurse-physician relationship. Anything go wrong there? Verbal orders that you can think of? And then the physician, when they come to talk with the patient. And then finally, again, pharmacy. Once again, the pharmacy at a hospital is just crazy. There's two places in the hospital that I think are the craziest, busiest places. One's emergency department, and the other is pharmacy. When you think about the pharmacy techs, what all they have to do, all the medications that have to go out, what are we looking at here? So what I'm going to ask of you is to brainstorm and think about this on the RN bigger level about mistakes. So I'm going to ask that you go into your groups that you were in yesterday. 1, 2, 3, 4, 5, 6, 7 groups. And I have papers here that we're going to break it down, like group 2, for example. You're going to think about what are the errors, medication errors that happen at the doctor's office and all of the potential people, and be creative. Because you know how many times things happen at the hospital and you think, who would have thought? You know, so why do things happen? But these become important issues. And why is this important? You know what's the leading cause of death in the United States? Any ideas? Heart disease. Idea of what number 2 is? Cancer. Number 3, medication errors. We're the 3rd leading cause of death in the United States. I call this like this is my iceberg. It's the tip of the iceberg. So how many times have you made a medication error, or you know someone who made a medication error? It wasn't recorded. These are the ones that are reported. Okay? Or how about the mistakes with pharmacy? So this is the 3rd leading cause of death in the United States. And you know, we have the American Heart Association that's putting information out there and demanding better care for heart patients. We have all of this with the cancer, and breast cancer awareness, all this. Where's the big push for medication errors? Who's talking about it?
What about in other countries? I'm sorry, what about in other countries? Is it the leading cause in other countries too?
I don't know about other countries.
I'm just curious to see where we stand with, compared to see if they're doing things better. Yeah.
I don't know, because it's a
been less in
completely
other
different
countries because they're
system.
not as heavily medicated.
That's probably true. Probably true.
Countries are probably not as prevalent because they don't need medications.
Yeah, they have a lot. They have a very different system too. Some other countries, like you don't go to the ED for your medication. You can go to the pharmacist and they'll give you some medication. So I mean,
They are already doctors.